What do you think about where things stand right now? Again, being the person who really started looking into the marketing towards children to begin with.
Well, I think we have two crises right now. One crisis is the epidemic of youth use of e-cigarettes generally, and this has been going on for some time now. We saw a 78% increase last year and then about another 30% increase this year on top of that of kids using e-cigarettes. And that's a crisis born of the access and appeal that these products have to kids, and it's driven primarily by the legally sold products like Juul and Enjoy, which kids are using to buy in convenience stores. The other crisis that we have right now are these acute lung injuries. And the two crises are not completely disconnected. If we didn't have so many kids using e-cigarettes, we wouldn't have kids put at risk for these acute lung injuries. But it's not clear that these acute lung injuries are being caused by the legally sold regulated products, which FDA does oversee the manufacture of. It appears that many of these acute lung injuries are being driven by illegal products that have oils in them that are causing things like lipoid pneumonia, because the legally sold products, the legitimate products, are typically water-soluble. They might cause hypersensitivity reactions. They certainly cause chronic lung injury. They're not safe. We believe they're less harmful than combusting tobacco and smoking regular cigarettes. But in the most cases, it doesn't appear that the legitimate products are what are causing these cases of acute lung injury that we're seeing.
Scott, can I ask you about one of the headlines that we just read, and I'm hoping you can help interpret this for me. Philip Morris and Altria ending their discussions for merger talks. We knew that had grown more complicated because of Altria's 35% interest that it bought in Juul last year. But in that announcement, they also go on to say that they're going to be launching on a product called IQOS. They say it's the only heated tobacco product with pre-market authorization, including 2 menthol variants from the U.S. FDA, which followed the agency's rigorous science-based review, leading it to determine that authorizing the product for sale in the United States is appropriate for the protection of public health. How much do you know about IQOS or IQOS, whatever you might call it?
So IQOS was approved recently by FDA. It's called heat not burn. It's basically a cigarette that you put in a device that heats the cigarette but doesn't combust it. And they brought forward data to show that it's not as harmful as lighting tobacco on fire. Again, not safe, but for a currently addicted adult smoker, it could be a less harmful alternative for a smoker who still wants to get access to nicotine from something that resembles a cigarette. I think the key here is to remember that Philip Morris went through the regulatory process, spent years doing it, probably spent hundreds of millions of dollars doing it, but it demonstrates that regulatory process can work for demonstrating that certain new tobacco products can get to market and can prove that they're necessary for the protection of the public health and helping currently addicted adult smokers quit. So far as I know, no vaping company, no e-cigarette company has been willing to engage that process and file an application. So, the process is open to them. They could have done this years ago. We asked them to do it years ago. The invitation's been out there for them to file for approval. And I think the fact that they haven't engaged the regulatory process and file applications makes them very vulnerable now as these lung injuries pop up. And, critics of them are conflating the acute lung injuries with the legally sold e-cigarettes. There is overlap between these twin crises, but in some cases they're distinct. But really, I think they're getting very little sympathy because they really haven't taken the steps to try to demonstrate that the products could be beneficial for adult smokers.
You just pointed out that when Philip Morris did this with IQOS, it took them years to go through the process and hundreds of millions of dollars. You would anticipate that any e-cigarette or any vaping product would face similar hurdles, that it would take years and hundreds of millions of dollars because people who have been investing in these products may not have recognized the timeline that would take if they actually did get regulatory approval.
I think the process is more efficient now. The agency, while I was there and since I left, has issued both guidance and regulations defining what that application process looks like. And in some cases, in some respects, Philip Morris was a pioneer. They came forward and filed that application before the regulations and the guidance were outlined. So there's a much more efficient pathway for people who want to engage it. I don't think any cigarette company would face the same challenges getting a product through the PMTA, what we call the PMTA process, the application process for a market authorization, as IQOS did. It's always hard to go first, and I think that process has been better delineated. It's not going to be a quick process, and it's not going to be inexpensive. You have to do some testing to prove that the products are less harmful than cigarettes and can help currently addicted adult smokers get off of tobacco. But that's the standard under the law. I mean, Congress passed this law on a broadly bipartisan basis, so these companies do have an obligation to engage that process at some point, and I fear that the process, that engagement really has to happen right now, given the risks that we're seeing from these products in the marketplace.